Hi there. So it is 8:30 on Friday, February 19th, and we are just about to go to our injection training at Advanced Fertility Care.
Yep, so we're gonna head over there. We'll vlog for some of you guys. I'm not sure how much we'll be able to vlog because we gotta be actively kind of participating.
Or how exciting it's gonna be.
Yeah.
But we've got all of our meds packed up. We gotta take these with us, and they're gonna teach us how to shoot up.
So with that, you're going to be injecting 10 units subcutaneously every evening, and we do want you to do that between 4 and 7. Okay, so the biggest thing is just being consistent. So choose a time within the 4 to 7 time frame, and just make sure it's going to work through this whole process, because that's also when you're going to be doing the stimulation injections. Okay, 90 degrees, bury the needle, inject, 90 degrees out, relax the skin.
Okay.
Any questions about the loop run?
No?
No?
Can it be in the same spot?
You can go in the same spot, just be aware you might get some bruising, so you may want to go in a different spot every time.
I can't use half of my stomach because I've got scarring
Okay.
for more than half of my stomach, so.
Then that's fine.
Okay.
Yes. In that situation, then yes, you can go in the same areas.
Okay.
All right. Just try your best to avoid places that are bruised or really tender. Okay. So then again, loop. Okay, so now we have our Menopur, our Lupron, and our Follistim all in this vial. So you're going to grab your syringe with the Q cap again, pull back to about 1.5, snap it on, inject, flip it upside down. You're going to withdraw all of the medication. You're probably going to have a little over 1 ml of medication, okay? And you can leave an air gap at the top. You're not going to get every last little drop out of here, but as long as you get the majority, that's fine, okay? You'll twist all of that off. Then you're going to get your subcutaneous injection needle, open that up. Yours are probably going to look a little bit different. They're not going to have this little doohickey on the side, so it'll just be that. Okay? So you'll twist that on, you're going to uncap, and then you want to hold your syringe vertically and slowly push up to get the air out of the top. So we're going to push up, and of course you will have more liquid in yours. So once you see a couple of droplets, then you're ready to do the injection.
Okay.
Still going in your belly, just like with the Lupron. Alcohol swab, big pinch, 90 degrees, bury the needle. You'll do the injection, 90 degrees out, relax the skin.
Okay.
So,
If there's, sorry to
You're
interrupt,
fine.
if there's blood, do I just pull out and then?
Nope.
No?
Nope.
Okay.
So if you pull back, and it actually does allow you to pull back, and this area starts filling with a little bit of blood, that's okay, don't panic. Just move your fingers, pull the needle out slightly, not all the way. Again, hold, do your check again. If there's resistance, meaning you're in the muscle, then you can go ahead and inject at that location.
Okay.
You don't need to bury it back down.
Okay.
Now, if you do the second check and there's still blood and you're not comfortable, then at that point, yes, go ahead and move your fingers, pull the needle all the way out, recap this one, get a new one, and start over.
Okay.
And go to a different spot.
Can he use it if there's like blood in there? He's still using the same. Oh, okay.
Yep, that's fine.
It's my blood.
So just switch out the needle. You don't need to switch
Yes.
the medication.
The reason we have you switch out the needles is because every time you insert it, it's gonna dull the tip. So that's why we have you use a fresh needle. All right.
People do this all the time, right?
Of course. So then 9 days after your transfer is when the pregnancy test is going to be. So again, that one's going to be a blood test. And the doctor's going to call you later that day with the result. So if it's negative, you're going to discontinue the medications. And if you have any embryos frozen, we'll coordinate you for a frozen transfer cycle. However, if it's positive, then you're going to take your last shot of the progesterone in oil and then switch to the progesterone suppositories, the vaginal suppositories, and then you'll stay on those, the estrogen patches, baby aspirin, and prenatals through 10 weeks of pregnancy.
Oh, okay. Like the suppositories through 10 weeks?
Yep. So I'll have you go through here, and I can get you copies of that as well.
Okay. Front and back, right?
Yep.
And back. Okay, so we just left the office and we had our injection training and everything seemed to go well. We also paid the big bill and
Cut out all the boring stuff of us assigning all the papers, but we made sure to film all the injection training.
I don't know if we're gonna put all of that on the vlog because that can get boring just watching 10 minutes of that too. But whatever. Anyway, keeping this short.